Hello, everyone. Welcome to this week's edition of the 5 COVID-19 studies the mainstream media refuses to report to you. According to a new study about COVID-19 PCR tests published in the Oxford University Press, at 25 amplification cycles, 70% of positive COVID-19 PCR tests are not really cases because the virus at that amplification threshold is not live. The virus detected at that amplification threshold is dead. According to this study, by 35 amplification cycles, 97% of positives are non-clinical because the virus is dead. And this is hugely important because the US runs 40 amplification cycles on our COVID-19 PCR tests, which is 32 times the amplification of 35 cycles. That is study number 1, and I think the significance of that data on COVID-19 case counts here in the US speaks for itself. Study number 2, a new review of 79 studies comprised of 5,340 individuals found, and I quote, "No study detected live SARS-CoV-2 virus beyond day 9 of the illness," end quote. If the virus isn't live, it's obviously not contagious. This, of course, contradicts the 14-day quarantine mandate imposed on us by politicians and public health officials. Study number 3, a new study from the CDC published in the journal Clinical Infectious Diseases reports that 2% of blood donors on the West Coast had antibodies to COVID-19 in December of 2019. In other words, before China had alerted the world to the virus, and over a month before the first case of COVID-19 was identified here in the US, the virus was already spreading here, unbeknownst to us. No hospital overflow, no crazy excess mortality. We didn't even notice. Study number 4, a new preprint from researchers from Norway and Sweden, led by Dr. Fredrik Juel from the Clinical Effectiveness Research Group at the Oslo University Hospital and the University of Oslo, found that the all-cause mortality rate of Norway, which implemented a harsh lockdown in the face of COVID-19, versus all-cause mortality in Sweden, which rejected lockdowns during COVID-19, was largely unchanged compared to data from the previous 4 years in both respective countries. The researchers found, and I quote, "Our study shows that although COVID-19 associated mortality rate was almost 15-fold higher in Sweden than in Norway during the epidemic, all-cause mortality was not higher in Sweden compared with 3 of the 4 preceding years," end quote. Does this tell us anything about lockdowns? I'll let you decide. Study number 5, a new peer-reviewed study set to be published this month in the International Journal of Antimicrobial Agents finds 84% fewer hospitalizations for patients treated with hydroxychloroquine, zinc, and azithromycin. This is what they say, and I quote, "Low-dose hydroxychloroquine combined with zinc and azithromycin was an effective therapeutic approach against COVID-19, end quote. The study was based on 141 patients diagnosed with COVID-19 who were given hydroxychloroquine, zinc, and the antibiotic, compared to a control group of 377 COVID-19 patients who were not given that cocktail of drugs. The study concluded, and I quote, "The odds of hospitalization of treated patients was 84% less than in the untreated patients," end quote. Makes you wonder how many lives could have been saved if the mainstream media and the left hadn't demonized that drug combination just because President Trump was touting it and they hate President Trump. Since public health officials and politicians and the mainstream media refuse to report any of that to you, I will.